Good afternoon. Today, Alberta is taking another hard but necessary step to bend the curve and get Alberta past this pandemic once and for all. I'm announcing today that starting tomorrow, we'll be putting in new targeted COVID-19 measures in place to help protect the health system and to drive cases down. I know that many people don't want to see additional measures, and I know that we're all tired of this pandemic and are desperate to just move on. A little more than 3 weeks ago, I stood in front of you and announced the return to step one of our approach due to rising hospitalization, growing case numbers, and increased spread of COVID variants. At the time, we hoped it would be enough to slow the spike of cases, begin to bend the curve back down, and buy us time to get more Albertans vaccinated. But the vaccines didn't arrive fast enough, and with hospitalizations continuing to rise, we're left with no choice but to take further action. Right now, there are more than 21,000 active cases in the province. That's the most we've had since the beginning of the pandemic, as part of the third wave that's hit so many places across the world. Our positivity rate is 10%, and variants now represent 63% of our active cases, and more are spreading every day. With our leading indicators still trending upwards, we have seen hospitalizations rise sharply, and there are now 632 people in hospital with COVID-19, 151 of whom have been admitted to intensive care. And that too is a record for Alberta during the pandemic. This week, AHS was forced to start postponing surgeries in Edmonton, Calgary, and North Zone, as well as reducing some non-urgent procedures and ambulatory appointments. These changes will allow our hospitals to expand inpatient beds if necessary, and to create more capacity for COVID-19 cases that require hospitalization. Because they are lagging indicators, we know that hospitalizations will continue to go up. And this is a problem, and it impacts everyone who needs care for any reason. It includes not only COVID patients, but also people who need surgeries, who get into car wrecks and who break their arm or are diagnosed with cancer or have so many other illnesses and challenges. We've seen what has happened elsewhere when hospitals become overwhelmed, and we cannot let that happen here. It's why we're making another tough call today. The restrictions currently in place will not bend the curve fast enough to get this third wave under control before the summer. And as much as we want to be in a better place with vaccinations based on supply, we still have many weeks to go until we reach broader community protection. The variants are a new opponent, and we need to do more now to safeguard our health system and buy us time to get more Albertans protected with their first doses. At the same time, we'll not penalize areas of the province where little or modest spread is occurring. Albertans have said loud and clear that this isn't fair, and we've heard them. And that is why, effective tomorrow, we are implementing targeted public health measures for hotspots across the province. These are communities or regions where there are more than 350 active cases per 100,000 people, and that have a floor of at least 250 total active cases. So this would include Fort McMurray. It also includes the cities of Edmonton, Calgary, Red Deer, Grand Prairie, Airdrie, and Lethbridge, along with Strathcona County. A list will be posted online. This means that we'll be moving all junior and senior high schools to at-home learning in these communities starting this upcoming Monday. Some of these schools will have already shifted to online learning, and the rest will join them in those areas. Although schools with protocols in place remain a safe place for students and teachers, and let me pause just to point out that we've only been able to identify about 2,500 cases of in-school transmission since Christmas, out of 720,000 teachers, students, and staff. That means that only about 1/3 of students have been affected by in-school transmission. Nevertheless, there is extracurricular transmission, and we did find over the Christmas break that the extension of online learning in junior and high schools was very helpful in reducing just general social spread. And that's why we are proceeding with this recommendation. It also means that we'll be closing indoor fitness and indoor sports effective tomorrow. Once they come into place, these mandatory restrictions will remain in effect for a minimum of 2 weeks, even if the municipality drops below the threshold at any point. After 2 weeks, communities will go back to the provincial measures, currently step 1, as soon as they dip below the 350 case rate per 100,000. Health officials will continue closely to monitor the spread of COVID-19 to assess how all of this is working. We'll also work with restaurants to increase stringency of verification that members of parties for patio service are from the same household or are the two identified close contacts of individuals who live alone. Where needed, we will implement a curfew where case rates are significantly high, specifically if cases are 1,000 or more per 100,000 population, and in cases where the municipal government requests it. These restrictions are so that are in target areas where cases are highest. If your community is not seeing high levels of spread, you won't see change. And I know that it's been a long road. I know many people will not want to take another step in this direction of more stringency, but we must. AHS and law enforcement will continue taking enforcement and issuing fines for noncompliance. And to ensure Albertans take these fines seriously, we are adding additional backstops with stronger fine collection and actions with restrictions at registry services. So that means if you are given a fine and you're not taking it seriously, you don't pay it, you will not be able to, for example, renew your driver's license, and there will be other implications with respect to registry services. These fines won't affect the majority of folks who are following the rules and are doing their part to keep our community safe. Rather, this is for the people who aren't taking the pandemic seriously and continue to put others at risk by not following the public health orders in place. Minister Shandro will have more details in a moment, but I wanted to take a moment to underscore the gravity of the situation that we're in today and how bad things could get if Albertans don't make a real effort in the next few weeks, because we already have very strong public health measures in place. And we are only able to identify about 5% of our traceable cases to workplaces. It continues to be the case that the vast majority of transmission is happening at home and through social activity. I once again call on all Albertans, please, if you need to, go back and study once again what the restrictions are that are in place. Please follow them so we do not have to come in with yet another round of even tougher restrictions. I know the last 13 months have been filled with uncertainty, worry, and stress. This pandemic has been hard on every family and community. But despite this, Albertans have done a great job navigating those challenges and coming together to protect each other and our health system several times. And luckily, we have the vaccines on our side in this fight. We've also expanded our contact tracing regime, our testing, and our health system capacity. But ultimately, Albertans have to step up to the plate in the next few weeks. Yesterday, Minister Shandro announced that we would be prioritizing 30,000 Janssen vaccine doses for Banff and the regional municipality of Wood Buffalo. Today, we expanded our vaccine rollout yet again, providing 650,000 more Albertans the chance to start booking tomorrow. We're offering the vaccine to staff and residents in group homes and caregivers of those who are most at risk of severe health outcomes. We're also offering it to the family and friends who care for residents in long-term care and to frontline police and firefighters who interact with our most vulnerable. We're also opening up Phase 2D. This means anyone who is 50 years of age and older, or in the case of First Nations and Métis Albertans, anybody who's 35 years of age and older, and they can book their appointments for vaccines starting tomorrow. As vaccine supply speeds up, so too does our response. And folks are working as hard as they can to get more jabs in the arms of Albertans. More than 1.5 million doses have already been administered. Another 70,000 doses of the Moderna vaccine arrived today, thankfully, that had been delayed for some time. And we'll soon be getting more than 230,000 doses a week of Pfizer, plus 30,000 doses of Janssen for the province's hotspots, as we announced earlier. In fact, we are now at about 40% of the adult population who have been vaccinated, and another 10 to 12% who have some degree of protection from previous infection. There is no question that vaccination is our ticket out of this. The sharp decline in cases, outbreaks, and deaths in elderly Albertans proves just that. Widespread vaccination is the finish line, and we all need to head for. We are well on our way and well positioned to offer every adult Albertan who wants a vaccine their first dose by the end of June, if the federal government provides the supply that they've committed to. And until then, we must rely on the very things that our province is known for: strength, resilience, and community spirit. Alberta Strong isn't just a motto. It is who we are. And if we just buckle down and bend that curve one more time, we'll be able to start getting back to normal safely and soon. Thank you. And with that, I'll invite Minister Shandro to offer some remarks, and then we'll also hear from Chief Medical Officer Hinshaw.
Thank you, Premier, and good afternoon, everyone. As Premier said, phases 2C and 2D of the vaccine rollout open up tomorrow. And with this expansion, over half of Alberta's population can now get their vaccine. Today, I'd like to provide more details on the 650,000 Albertans who can start booking vaccine appointments tomorrow. And this includes staff and residents who provide care or support to Albertans in congregate facilities and the community who haven't yet been offered immunization, as well as frontline disability workers and those who work in group homes, mental health or addiction treatment, group care, as well as other types of licensed supportive living. And designated family support folks of those individuals who are in long-term care, designated supportive living and licensed supportive living facilities can also book their shot starting tomorrow. We've also opened the booking of vaccine appointments to parents or guardians of children under 12 who have one of the eligible chronic conditions in phase 2B, but because they are under 12, they are unable to receive the vaccine because of their age. And this also applies to all household contacts and caregivers, to those who have been profoundly immunocompromised that require the second dose 3 to 4 weeks after the first. And this is the group that was announced last week. Also eligible are frontline policing, sheriffs who interact with residents at shelters, at correctional facilities, and at remand centers, the Canadian Border Security Agency staff, and firefighters as well. As well, all Albertans between the ages of 50 and 64 can now book their shot, along with any First Nations, Métis, and Inuit individuals who are between over the age of 35, as Premier said. And I know that it's been, this is a very long list, and I went through very quickly, so I encourage folks to look it up on alberta.ca/vaccine to see if you or someone that you love is now eligible to receive their first dose. We want to vaccinate many, many more Albertans, but we can't give out those doses that we don't yet have. We've been getting vaccines out the door as quickly as possible as we can as we receive them from the federal government. Alberta has been one of the best vaccine rollouts in the country, and we're consistently leading among major provinces for percentage of received doses administered. And though it may not feel like it, we are in the home stretch of this pandemic. We're getting closer and closer to offering the vaccine to all Albertans who are over the age of 18, or their first dose, I should say. The sooner that we can get people immunized, the sooner that folks can get protected. And the sooner then that we can, as a province, get back to normal. And I know that people want to know more about phase 3, and we'll be announcing the details of phase 3 very soon and providing those details to Albertans. We're so close to turning the page on this virus. We just need to, as Premier said, dig in and do our part to make it through by reducing the spread over the next few weeks. And thank you very much. I'll now invite Dr. Hinshaw to provide today's COVID-19 update. Dr. Hinshaw?
Thank you, Minister, and good afternoon, everyone. Before I begin, I want to let you know why I'm providing this update from home today. I had a sore throat yesterday, so was tested for COVID-19. Although that test came back negative, I was still feeling a little under the weather today, so I'm staying home to be safe. It is an inconvenience, but this is an important part of how we all help stop the spread. Moving on to today's update. As the Premier mentioned, we have now administered more than 1.52 million doses of vaccine in the province. Over the last 24 hours, we identified 2,048 new cases of COVID-19 and completed about 20,500 tests. This puts our positivity rate at about 10.1%. Over the last 24 hours, we have identified more than 1,300 variants of concern. Variants now make up approximately 62% of all active cases. There are currently outbreaks or alerts in 750 schools, which is 31% of the schools in the province. Sadly, 3 additional deaths were reported to Alberta Health in the last 24 hours. As always, I extend my sympathies to all those who have lost someone they cared about, whatever the nature of that loss. I'd like to begin today by talking about the draft triage protocol for critical care that AHS developed and what this means. As I've said before, this is not my document. However, I know that discussion of these protocols can create anxiety for many people. Since the pandemic began, Alberta Health Services has been working on updates to this draft critical care protocol based on work from the 2009 H1N1 pandemic. This protocol, if needed, would be used to help decide how to allocate intensive care resources should the healthcare system be unable to meet the demand of the current COVID-19 pandemic or any other disasters. These protocols are a last resort and can seem scary, but it is important that this work be undertaken as a precaution and that the necessary healthcare professionals have an understanding of what these protocols mean. This is the work that my AHS colleagues have been undertaking over the past year. We are not at the point now of needing to use this protocol, and I hope that we never reach it. Just as field hospital planning was underway in December and January, even though we didn't end up needing those resources, this planning has been underway all year. AHS has capacity for current needs and can still increase it if demand increases. With that in mind, AHS is now implementing additional temporary surge capacity measures at some healthcare facilities. These surge measures are similar to those put in place during the first and second waves and include postponing some non-urgent scheduled surgeries that require a hospital stay. AHS will strive to avoid postponements whenever possible. Surgeries that will go ahead will be limited to cases that require urgent treatment in less than 7 days, as well as emergency and trauma cases and cancer procedures. Any patients whose surgery is being postponed will be contacted by AHS, and these will be rescheduled as soon as possible. These measures will help free up space in our hospitals for patients who need a higher level of care and give AHS the flexibility to redeploy frontline staff and resources to where they're needed most. The bottom line is that our health system has capacity and can take steps to increase it, but the strain is growing. That is why we must bend down the curve as quickly as possible. And it is why I strongly support the measures being implemented today. Additional restrictions are absolutely necessary as we face our highest active case counts ever and rampant spread of COVID-19 in many regions of the province. We know these restrictions are disruptive to Albertans and businesses, but we must bend down the curve one last time to protect our health system and ensure it is there when anyone needs it. I want to thank the vast majority of Albertans who continue to do the right thing and follow the public health orders in place. I know it isn't easy and we are all very tired, but we are nearing the end of this pandemic. To those Albertans who may not be following the rules or who could do more to limit transmission, I urge you to do so now. We have seen these measures work before by all working together. So I'm asking all of us to follow these measures, to make the safest choices possible every day, and to get the vaccine as soon as you are able. Thank you, and we're happy to take questions.
Okay, we will go to the phones for questions now. We ask that you do 2 questions each, either 2 off the top or 1 question and 1 follow-up. Operator, can you please put through our first caller?
First is Dean Bennett with the Canadian Press. Go ahead, Dean.
Thanks. Premier, can you help me with something here? So in the last week, on Monday, you said you resisted restrictions. The existing ones are fine. People just have to follow them. And you know what? If we put in new ones, they probably wouldn't follow them anyway. On Wednesday, you went even further. You said it's a hit and miss proposition. Even if we have restrictions, people might not follow them anyway. Or it might not work, I'm sorry. The restrictions might not work. And now 24 hours later, we've gone a completely 180. Now we need these things. We need these restrictions. Heck, we'll even do curfews if we need them. And we have even more restrictions because this is what we need to bend the curve. I'm sorry, Premier, I don't understand where you stand on fundamentally where you stand on restrictions. And I think it's important because, you know, this could change again on a dime in 24 hours. Sorry, Premier, where do you stand fundamentally on health restrictions?
Well, actually, Dean, what I said on Wednesday was just yesterday was that we had additional targeted measures under active consideration. I was talking about this package. What I've always said is that we are open to bringing in additional targeted measures if we deem them to be necessary. I've also been consistent from day one that we view restrictions that can have really a real damaging effect on our broader social health as a last and limited resort. I've been clear from day one that Alberta's approach is not indiscriminately to damage people's lives and livelihoods, but rather to seek a balance between the protection of lives to avoid large-scale preventable deaths, to protect our healthcare system, while minimizing the negative impact of restrictions on our broader society. So those have always been our goals. That's always been our policy context. And we've been clear that we will use restrictions on a targeted basis to control spread when we deem it necessary, and we clearly deem it necessary. As I said yesterday, we have additional targeted measures under active consideration. So, and let me be clear, I hope that these measures, together with everything else that's been in place, many of those rules for months, some of them for a year, I hope that all of that will be sufficient. If Albertans respond to this call for buckling down in the next few weeks, but if that's not the case, and if we continue to see current levels of case growth, then we will consider bringing forward additional restrictions. So I don't think it's difficult to understand that we have been bringing in restrictions based on the numbers and based on the risk associated with them to control spread, but to do it in a way that minimizes the damage in our broader society.
Dean, do you have a follow-up?
Yeah, so how effective do you think this is going to be? Let me give you an example. If I live in Airdrie, which I think is one of the areas you said, so if I live in Airdrie and I'm not really keen on these ideas, this plan, well, you know what? My MLA, she's with the UCP, she doesn't agree either. And the Premier, well, he's already said fundamentally that the existing rules are fine, and if we brought in new rules, people wouldn't follow them anyway. And then on top of that, the government's now promising, oh yeah, we'll do a lot more tougher enforcement, but this is the same government that let restaurants off the hook and let Grace Life have a 6-month free pass. So my question is, has the behavior and the statements from your party and your government undercut your message now, especially when we need it most?
Well, Dean, I think there's a lot of inaccuracies there. For example, as you know, it's not the elected part of government that is responsible for enforcement None of us want to live in a place where politicians decide who is penalized and how. We do leave that to our independent and professional law enforcement agencies. So when you refer to enforcement, we trust their judgment about the best way to get compliance. That's always been our focus. Our focus is not punishing people for the sake of it, but rather getting the broadest possible compliance. And that is something that law enforcement agencies and regulatory agencies have to work out with, in some cases, the Crown Prosecutor Service, all of that independent from the elected side of government. With respect to the fact that we've changed policy from time to time, so has every jurisdiction on the face of the earth, Dean. Because COVID changes, the threat level changes, the virulence of the virus changes, and so policy changes with it. I don't accept the kind of premise of your question, which is that policy is only credible if it's frozen or if it's set in stone. To the contrary, I think the reason why every jurisdiction, at least in the Western world, I think every jurisdiction on earth has moved from varying degrees of stringency and relaxation of measures is to reflect what's actually happening. I'll remind you that from sort of February through till February through till late March, we saw a very significant decline. Things were going in the right direction with respect to hospitalizations and spread. Things have changed dramatically since then, and we've changed policy to reflect those new circumstances. We'll continue to do that. We're not going to, our policy will not be governed by a foolish kind of consistency. It'll be governed by principles and our goals: controlling spread, to avoid large-scale preventable deaths, to protect the healthcare system and minimize the negative impact on our broader society.
Operator, can you please put through our next caller?
Next is Bill Kaufman with Post Media. Go ahead, Bill.
Yes, Premier Kenney, I'm just wondering if these restrictions aren't placed on the entire province, aren't you concerned that these very contagious variants will spread to those areas pretty quickly, more quickly in the areas that aren't covered by these new restrictions?
Well, the reality, look, there's always the possibility that people are going to engage in non-essential travel. We urge people to avoid non-essential travel. If they don't really have to travel for work or essential reasons, we encourage them. And I'll say something very clearly that I've not said before. At this point, if I encourage people, if they can possibly do so, to stay home. And if they can possibly do so, to stay in their own community. We've advised against non-essential travel in the past. It's more important now than ever. Now, as you've seen in British Columbia, and let me just point out that virtually every other jurisdiction in Canada has taken a regional approach through much of the pandemic, finding it more effective to focus the most stringent measures on those areas with highest spread. That's what we're doing here. Just as Saskatchewan has, for example, in the city of Regina, it seems to have been effective there. The BC approach, where they've tended to focus on the Fraser Valley Health Region, seems to have been effective. The Quebec approach of focusing on the city of Montreal and a couple of other urban areas also seems to have been effective. So there always is that chance of transmission through travel, and that's always going to exist in a free society. But it doesn't make sense to us that we would apply these new measures with the same rigor to a sparsely populated area with very low viral spread and with capacity in their local hospitals, as opposed to some areas. Right now, as you know, the regional municipality of Wood Buffalo declared a state of local emergency because they're facing a case count of about 1,400 per 100,000 people, pretty remote from other large population areas in the province. And we're responding to requests for a more concentrated approach in areas like that.
Bill, do you have a follow-up?
Yes, I'm just wondering, you've said that there's really no linear link between these tighter restrictions and tamping down, the reduction in infections. I mean, if that's the case, then why bother with any of these, stepped up restrictions?
No, my point is that there are some people who seem to believe that the stringency of restrictions is the only factor in viral spread. My point is that's clearly not the case. But at the same time, appropriately targeted restrictions can be very effective. We saw that. We've seen that throughout COVID in many jurisdictions. My point was simply that, for those who argue for quotes COVID zero and hard lockdowns everywhere and all the time, that is not necessarily the most effective policy. Here's a case in point. Our two neighboring provinces of British Columbia and Saskatchewan have broadly similar COVID policies to those of Alberta, but in those two provinces, they see case numbers going down. I mean, there are some minor differences. We allow 15% of people to gather for congregational worship versus zero in BC, but they have regional travel restrictions where we don't. But apart from the margins, we have broadly the same policies, and they have lower case counts. They do in Saskatchewan. The city of Toronto has had what I would characterize as a pretty hard lockdown in place now since December, and they've had a very serious problem, as you know. So my point is simply that there is no one-size-fits-all approach. As Dr. Hinshaw has said many times, I think quite wisely, there's no one way through COVID. We are all learning as we go. My point in part is that there are many, many other factors: population density, climate, weather, and most importantly, the willingness of the broader population to comply with public health measures, which varies greatly from one jurisdiction to another. So the important thing is this. If Albertans take this seriously, and I think that more stringent measures like this can at least get people's attention that this really matters, and if people follow what we're calling them to do, especially in those areas where there is a surge in cases right now, we can get past this and let the vaccines start to beat the variants, I think, by a month from now.
Operator, can you please put through our next caller?
Our next question is from Jocelyn Laidlaw with CTV Calgary. Go ahead, Jocelyn.
Thank you. Hi, Premier. Hi, Dr. Hinshaw, Mr. Shandro. I wonder, perhaps this is for Dr. Hinshaw, but I'll let you take a stab at it, Premier Kenney. How close are we now to capacity in our hospitals across Alberta? And then what is the plan to deal with the demand beyond the system's capacity? In other words, are we looking once again at field hospitals? If so, where and how many? What's your emotional threshold for this?
Well, sorry, I'm not sure about how to define an emotional threshold, but I can tell you what the healthcare capacity is that we believe that we can set aside and open upwards of 2,200 hospital beds to accommodate COVID patients. We're now at about 650. So as Dr. Hinshaw said in her opening statement, we do have capacity, and we are taking measures to ensure that capacity is available for patients in the foreseeable future. We have spent the better part of last year working very closely with AHS to ensure that they have all the resources that they need to maximize their healthcare capacity through the pandemic. That has included, I think, upwards of $3 billion in additional spending in the healthcare last year. It involves the $1.2 billion COVID healthcare contingency this year. We've taken, for example, our contact tracing. When we started the pandemic, we could do about 350 investigations a day. Our surge capacity in that system is now about 2,500 investigations. We've been able largely to stay on top of testing. As you can see, we're achieving our daily kind of stretch target in the 20,000 tests a day range now. It's true that both contact tracing and testing are under more pressure now, and if the numbers continue to grow, that will have a real effect on them. But my point is that we have built in that capacity. Ultimately, the challenge in the healthcare system is on the workforce side, because we can't just we can't write a check to suddenly bring in hundreds of additional anesthesiologists, respiratory therapists, and our ICU nurses, for example. Every jurisdiction in the world has been clamoring for people with those skills. But that's what we define our sort of capacity at about 2,200 staffed and functional hospital beds for COVID. We don't need to go there. If we bend the curve, we will have significant stress in the healthcare system, but we will not be coming close to its maximum capacity.
Operator, can you please put through our next caller?
Next is Lisa Johnson with the Edmonton Journal. Go ahead, Lisa.
Hi, thanks for taking my question. Today we saw the Alberta pediatricians calling for tighter restrictions in Alberta, specifically the closing of non-essential businesses and corresponding supports from the government, including supports for paid sick leave. They basically sounded the alarm over the increase in hospitalizations among young people, and they're very worried this is going to stretch the capacity of the healthcare system. So I'm wondering how you would respond to that.
Well, I appreciate their input and their good professional work on behalf of kids. I would say that, first of all, that a lot of businesses are closed. We'd like to avoid the essential, non-essential designation, because I think it's arbitrary, and every business is essential for the people that work there and have a stake in it. But we've had venues, casinos and concert facilities, convention centers, nightclubs, etc. Thousands of businesses have been closed now for a year. So let's not minimize the huge sacrifice that has entailed. Many other businesses are substantially impaired right now. Our current contact tracing data indicates that amongst our traceable cases, only about 5% of our current active cases were likely acquired at the workplace. So shutting down tens of thousands of other businesses where there is little or no transmission, and putting hundreds of thousands of people out of work would have very little measurable impact on viral spread. We need to focus on where it's happening, which tends to be at home and through socializing. But we continue. I mean, by the way, every business has to comply with a whole spectrum of public health guidelines. I want to emphasize that. Masking, unless people are at their individual workstations. Obviously, people are asked only to go to work if it's necessary, and all of the other protocols that are in place. And finally, with respect to paid sick leave, I would point out that the federal government put in place a program that provides for $1,000 payment for two-week periods of COVID-related sick pay. In addition, Alberta has put in its own program, which provides for up to 14 days of free room and board, plus $605 in cash payment to individuals who need to self-isolate because of sickness. So if you're sick with COVID in Alberta, you can, first of all, you have job-protected sick leave in legislation, and you can also receive over a 2-week period I should say about $1,400 in non-monetary support through free room and board through self-isolation hotels, and between the federal and provincial payments over $1,600. So I think it's important that we make people aware of the support that's already there.
Lisa, do you have a follow-up?
Hi, yeah, I need to address some of those comments regarding sick leave. I mean, people are saying that the federal program is not adequate and takes too long. So I need to push back on that. I mean, $1,000 over 2 weeks is not exactly accurate. After taxes, it's $450 per week. So and it can take too long. So for an essential worker who is sick, it might not help them. I mean, is there anything that this government is willing to do in order to incentivize workers from not going to work while they are sick. In Ontario, for example, they've just introduced a package for 3 days of paid sick leave. I'm stunned here because I have a number of other questions. Sorry.
It's all right. You've been cutting in and out of there.
Paid sick leave. I'm also curious to know, the pediatricians are saying that at this point, younger people are at more risk and they're being hospitalized at higher rates. So I'm wondering what you can say to address their specific concerns as well.
Okay, unfortunately, we didn't quite get all of that because your line was cutting out. But with respect to support for workers who need that's why Alberta was the first province to offer very generous self-isolation support where people can get room and board, so free accommodation and meals. And other support in addition to $625 payment. So that has a total monetary, non-monetary value of $2,000 in addition to the $1,000 payment from the Government of Canada. So I think our support is as or more generous as any province in Canada. And with respect to children, yes, the evidence is that the new variants do affect younger people more than the so-called wild variant of COVID-19 or the wild version of the virus that we've been contending with for most of the past year. And that's a very real concern, which is one of the reasons that we need people to help us bend down the curve, especially with these new variants.
All right, we have time for 2 more questions. Operator, can you please put through our next caller?
Next question is from Julie DeBelliac with CVC. Go ahead, Julie.
Hi, Premier. You mentioned added enforcement at restaurants to ensure people are from the same households. Are there any additional resources or funding for staff or security at these restaurants that are being considered? And what would you say to staff who are already under stress expected to enforce masking and distancing, who might see this as an added burden placed onto them?
So we're going to work with the restaurateurs in a plan of action that helps them and helps us to ensure that folks being served at patios are complying with the rules. Look, there is not a risk of transmission for a family group, a family that goes and eats outdoors, distanced from other tables, in a restaurant that's carefully following all the guidelines. What concerns us is cases where individuals from outside the same household or who are not the identified close contacts of a single individual might end up socializing at a patio. We think that the risks of transmission are very small, given that they're outside, but they're more than zero. And that's why we do want to work with the restaurants to come up with a plan of action to address that. We understand, we don't want to turn servers into bylaw officers, but we think there are protocols that they can follow. For example, to require people for our household group for their information, perhaps using reservations. We're going to sit down and work with Restaurant Canada and other associations to ensure that they're doing everything possible within reason to make sure that their patrons are respecting those basic guidelines.
Do you have a follow-up, Julie?
Yeah, just in terms of enforcement in general, besides personal responsibility, is there anything else people can do when they see other people around them defying health orders? Will AHS respond to complaints?
Well, AHS has a complaints line and a complaints email account. By the way, it's always been there. It's not new because AHS does have enforcement responsibilities for public health generally. And so if people see what I would call flagrant examples of noncompliance and they feel it needs to be brought to attention, they can do that. I want to thank all of the bylaw officers and peace officers who have been doing their best. I don't know, Minister, would you like to speak more to this? Because part of your department is responsible for that.
Yeah, thank you, Julie. As Premier said, there is a complaints line and email and a pipeline into AHS for them to be able to investigate. A lot of their enforcement is complaints based. So obviously they're not roaming our communities looking for violations, but when they are aware of a violation of the health guidelines or other public health measures, that they do investigate based on those complaints. So they have received those complaints, and it's been the source of those investigations that they've done, as they do, as Premier said, before the pandemic. And so there's still those opportunities. But we hope as well, though, that as most Albertans have, that it is rare for people to not be. Most Albertans are following the public health guidelines, which is why our numbers had come down in February and January. We look forward to Albertans continuing to do that. We have a few more weeks of getting through this before we have the vaccinations helping us get our cases down and our hospitalization pressures down.
Operator, can you please put through our last caller?
Final question is Audrey Naveau with Radio Canada. Go ahead, Audrey.
Hi, my question is for Premier Kenney. As usual, I'd like to hear you in English and in French. The portrait you're painting today is quite dire. We're breaking several records from the beginning of the pandemic, but a lot of people seem to be a little bit lethargic and they're not as alarmed maybe as in the first and second wave. So the restrictions you're presenting today are one step further, but they're not like a shock. Don't you want to shock people into realizing we're near the end? We have to do this one last time?
That's a very good question, Audrey. I think there are a good number of people who have just kind of tuned this whole thing out. Some people have just quote unquote moved on, and they are so tired of it. They aren't listening to these news conferences or government messages or advertising, and think that the rules are maybe some of these people have their first dose of vaccine, or they are just done with it. So I understand that. By the way, we do intend to use our emergency alert system through the Emergency Management Agency, which is sometimes used for those Amber Alerts, to send out a message to every Albertan cell phone in the coming days about these additional measures and reminding them about all of the public health restrictions. So we're going to put that in a very loud and visual way in front of everybody, hopefully to regain their attention. So this is, you pointed to a great challenge that we are facing. A chunk of the population who have, in their own minds, I think, just moved on. And all I can say is that I don't want to be standing here 2 weeks from now having to bring in something like a hard lockdown on Alberta that we've managed to avoid as a province in the past year because people don't respond to this call. We see the numbers starting to come down in other provinces, and including other provinces with similar restrictions in place. If they can do it, we certainly can here in Alberta. So we hope that today's measures, they are a layering of protection on top of so many other rules and measures that are already in place. We hope that will make the difference. I'll try to say that in French. Je sais qu'il y a pas mal des Albertains qui ont tanné avec le COVID-19, avec toutes les mesures qui effectivement ignorent les messages du gouvernement et les publicités et les politiques. Mais tout ce que je peux vous dire est qu'il faut il faut qu'ils prennent la situation au sérieux. Sinon, dans quelques semaines, peut-être la seule option pour le gouvernement sera un lockdown comme nous avons vu dans les autres juridictions. Est-ce que les Albertains veulent les curfews comme nous voyons à Montréal? Je ne crois pas. Mais on a de moins en moins des outils pour protéger le système de santé. Alors, on va utiliser les autres outils comme les messages d'urgence sur tous les téléphones cellulaires dans les prochains jours, peut-être pour attirer l'attention de certaines personnes.
Do you have a follow-up, Audrey?
Yes. Premier, don't you think you've done enough warning with these incremental measures? You keep saying, if you don't do that, next time we'll put these measures in place. And then you put these measures in place a couple of weeks later. So don't you need to do a big measure right now to stop the third wave in its tracks?
Again, we had different stages of measures and restrictions in the fall that collectively proved themselves to be effective. It's about layering different measures on top of other measures, and that's exactly what we're doing here. Similar measures apparently are effective in bending the curve in our two neighboring provinces, and I believe they can be similarly effective here. In French, on a vu dans le passé que les mesures supplémentaires, toutes en total, étaient effectives. Et nous voyons la même chose dans les provinces de nos voisins, en Colombie-Britannique et en Saskatchewan. Alors, je crois que nous pouvons avoir les mêmes résultats ici en Alberta. Thank you very much.
Thanks, everyone, for your time. Have a good evening.